What we now know from the evidence that was laid out in this trial was that Johnson & Johnson was a pharmaceutical company that went about a massive and misleading and false advertising, effectively a marketing campaign, in which they had sales representatives target high-volume prescribers, so doctors that they knew would be amenable to prescribing more and more opioids, and encouraging those doctors to prescribe higher doses of opioids, and also trying to convince folks, doctors and patients alike, that these were safe and effective drugs, that addiction was not a problem, that it was perfectly fine to take them at high doses for long periods of time. You know, one of the things that came out over the course of this trial was that Johnson & Johnson representatives, sales representatives, made, I think it was 150,000 calls just across the state of Oklahoma, sales calls to doctors, pushing them to prescribe these opioids. And so, you know, it's correct that ultimately the doctors are the ones that are prescribing these drugs. However, Johnson & Johnson played a huge role in influencing those doctors. And another thing that we know that Johnson & Johnson did was support the pain patients, the advocacy groups specifically that were advocating on behalf of pain patients. You know, when a message is coming from a doctor or from a patient advocacy group, it seems much more trustworthy than a message coming from a pharmaceutical company. So we know that they really leveraged, you know, those messaging techniques, and as a result, the prescribing of opioids in Oklahoma and really across the country skyrocketed.
Oklahoma also argued that Johnson & Johnson targeted young children in its efforts to expand the opioid market. The state compared the company's recruiting tactics to those of the tobacco industry. Julia, tell us more.
So it seems like there was no population that was sort of off limits for Johnson & Johnson to basically push these opioids onto. And, you know, from a marketing perspective, it makes sense. If you can get more people hooked on these drugs, especially people from a younger age, then you'll have, you know, lifetime customers, as it were. However, you know, as we know, these drugs are extraordinarily addictive, and there are all sorts of negative effects to prescribing these drugs. So, you know, we have all this marketing information now that if you were just taking an economic perspective, you would say, oh yeah, that makes sense. Target as many different populations as you can. Target people with cancer pain, target people with non-cancer pain, target old people, target young people. And in reality, that kind of targeting has really devastating consequences.
You wrote a piece not a little while ago called "Inside Johnson & Johnson's Quiet Domination of the Opioid Market." Explain how key Johnson & Johnson was and how this market and the epidemic developed simultaneously. How did they do it? There's so much that is not known about the way these companies operate with their secret documents that now come out in trial.
Sure. So the company's role was really multi-pronged. So on the one hand, they had their own opioid products that they were selling and they were marketing, and they had a whole sales force of folks who were going to doctors and encouraging doctors to prescribe those medications. But also, and this is something that I think that most people don't know about Johnson & Johnson. Johnson & Johnson had two subsidiaries that were responsible for manufacturing the majority of active ingredients in opioids that were marketed and sold in the United States, not just Johnson & Johnson opioids, but all sorts of opioids. So the way that they did this was back in the 90s, they had developed this high thebaine poppy. Thebaine is a type of opioid that's used in a lot of painkillers. And back in the 90s, they were able to connect with what is now Purdue Pharma to basically say, look, we have all these poppies, we have this active ingredient, we can help you to make this opioid painkiller, and we can supply as much of it as you want. And over the years, Johnson & Johnson subsidiaries ended up providing pharmaceutical companies across the country with 60% of the active ingredients that are in painkillers. So, on the one hand, you have Johnson & Johnson with its own painkillers and with its own sales force, but they also were quietly playing this really massive role in providing the entirety of the United States and its pharmaceutical companies with the active ingredients that ended up in painkillers and medicine cabinets all over the country.